Hi, I'm Shenoy here and I'm delighted to welcome you to my video logs on healthcare. In this series, I will be talking about issues pertaining to healthcare industry, specific to hospitals and doctors. I really wanted to thank you for taking the time out to watch these videos, and I look forward to furthering our interactions. So what I'm trying to say now is that people who have done well in the past, so when we look at our industry, we see some top-notch hospitals which are doing very well. We also see some doctors who are actually star performers now. They are on the top of the heap, right? Now most of them have been around for 25 to 30 years. Whatever worked for them to reach that place is not going to help us to move there. So what worked for Dr. ABC, who's a star, it started 25-30 years ago. And 25-30 years ago, life was very different. There was no internet. There was no social media. Patients were not so empowered. There was no hostility in the media. In fact, we did not even know that we needed to market. So the environment has changed, and what has helped people to become successful today, the ones you see successful today, is not going to be the way we will be successful in the future. So we must adapt new age strategies and master the execution today. For those who are doing well, we must understand that in case we continue to not adapt to what is happening, we may get left behind. So that is the reason why I said, let's look at this topic, marketing, and dive deep into it. I was actually really very disappointed in the last few years when I see my doctor colleagues and even hospitals not able to get the right kind of even marketing vendors. I find people spending money on websites, on social media, on BTL, ADL, and not getting the proper returns because we don't know how to get it done. So I said, let me empower hospital managers and doctors. I went deep into all this stuff for the last 25 years. I have been in this industry. Last 15 have been spent on profitability and stuff like that. I don't want to go deeper into it, but just to give you context, I realize that this is a major issue that all of us are facing. Just this week, 2 days ago, I was advising a hospital, a cancer hospital, super hospital. I mean super in the sense that it has got great equipment right in the middle of India, but very performing really pathetically. Why? Because they have no clue on how to market. They have a great team, they have a great technology. Unfortunately, marketing is so weak that it's almost non-existent. Now, cancer is not easy to market. It's not an easy specialty to market or a hospital to run. So in today's next 30 minutes or so, we will focus on the following. One, I will try to, we'll appreciate what are the 4 principles of ethical marketing. Yes, I'm talking about the principles of ethical marketing. All of us want to practice ethically. All of us want to do the right things. We just don't know how to do it. And so I will spend some time on that. We will identify gaps with the present marketing activities that we are doing. Identify some gaps. I'm not going to go so deep or into detail, but we'll understand the basics of what is happening. Then we will try to create an understanding that marketing, sales and branding, are they different or are they the same? A lot of my doctor colleagues believe marketing is just one umbrella term. We'll go deeper into it and understand it. At the same time, we will also try to understand the consequences of treating them as similar. And last but not the least, I will introduce you to what I feel is the solution. So this solution has been worked out on the basis of the fact that what is happening in the industry, what is the domain like, which is the healthcare. Now within healthcare you just can't say that the practice of a diabetologist is the same as the practice of a bariatric surgeon or a cosmetologist. Every practice is different. Within the practice itself, every doctor's practice is unique. So what is it that we can do to make sure that all these are effective? So I created a solution called the integrated sales machine. In case you hearing it for the first time, don't worry. It is quite novel. It is using cutting edge technology. It is using cutting edge methodology. It is also talking about domain expertise. So I'll introduce you to that machine, and that will be the end of our conversations today. So, are there any queries around this? I will give you enough time to ask questions. So there will be time for a Q&A in case you need some clarifications. We want this to be highly interactive. We will try and create an atmosphere where we learn from each other.